Jia is the eldest of 3 children. A year ago, she lost her right eye to retinoblastoma, a cancer of the retina cells. At just 12, her vision was impaired. A few years after, her younger brother lost both his eyes to the disease. Now, it's her youngest brother, just over a year old, who's been diagnosed with the same cancer. Her mother recounts the toll it's taken on their family.
पहले तो अपना गाड़ी था, जमीन था, बेच दिए सब। बेच कर सब दोनों में लगा दिया, दुकान सब। फिर ये हुआ तो अभी ये बीमार पड़ गया, तो इसके पापा 3.5 लाख लोन लिए हैं, उसको भर रहे हैं वहाँ पर गांव पर। इसको इलाज हम करा रहे हैं।
This shelter, run by an NGO, CanKids KidsCan, houses dozens of cancer-stricken families like Jia's. 5-year-old Zainul is among the survivors. Her leukemia is in remission after rounds of chemotherapy that her mother describes as the most harrowing experience of her life.
ये बहुत दिनों तक तो हंसी भी नहीं, बोली भी नहीं, एक ऐसा लगता था एक मूर्ति बन गई हो। तब बहुत दर्द होता था, लेकिन जब ये अब हंसती है, खेलती है, बोलती है तो बहुत अच्छा लगता है।
Their joy hides layers of pain underneath.
सबको उम्मीद थी कि बेटा होगा। वो जब पैदा ही हुई थी तभी किसी को पसंद नहीं थी। जब इतनी बड़ी बीमारी से लड़ी तब कैसे कोई साथ दी।
Social exclusion and financial ruin are among the many challenges Indian families battling cancer can face. According to government data, India recorded about 1.4 million new cancer cases in 2022. That number could rise to about 1.6 million by next year. Experts warn there could be just as many undetected cases. An estimated 4% of all cancer patients are children. And while experts say younger patients are more resilient and responsive to treatment, India's stretched medical infrastructure widens the gap between those who survive and those who don't.
In the developed countries, 80% children survive, right? Survival rates are at 80%. In low middle income countries like India, survival rates are around 20 to 30%. A big part of that reason is that children are not being able to access care. So if they don't access care, then they will not survive. On an average in India, we believe that survival rate is about 50 to 55% when children reach a cancer center.
As India's cancer wards continue to overflow, the government has announced a number of new measures. They include a new national screening programs focused on the most common cancers such as cervical and breast cancer.
We have sent one sample to AIMS also.
Several funds, including a federal health insurance scheme, a financial assistance program tailored to the poorest, and a cancer fund have also been set up. The government says facilities have been upgraded at dozens of government-run hospitals to tackle childhood cancer specifically. We're in a government-run hospital where the cost of care, medication, diagnostics is all taken care by the state. But all of these costs can rack up pretty quickly to thousands of dollars in private hospitals. And that's where the role of civil society groups comes in. With overwhelming demand for government facilities and limited availability, joint efforts are necessary.
So we have extensively mapped states to see where are these hospitals, what do we need to do to help and work with the government or the private sector to strengthen the hospital network.
Doctors say India's rising cancer cases are also a byproduct of rising population and longevity. Rapid industrialization and changing diets and lifestyles also play a part.
We are matching the Western world in terms of hypertension, diabetes, and now cancer as well. So overall, the burden, disease burden that we have of the two groups of diseases together is really going to be a major challenge in the next few years.
India's huge pharmaceutical industry produces cheaper cancer drugs than most major economies, but cheaper may not always mean better.
The drug control authorities and a lot of regulatory agencies, the CDSCO, they are now focusing a lot not just in quick licensing, but in doing much more quality checks.
The government also has recently removed tariffs on 3 crucial imported cancer medicines to make care more affordable.
ये अभी हम लोग क्या सीखने वाले हैं?
With proper care, 8 in 10 children can beat cancer. This school in Mumbai, run by CanKids KidsCan, teaches survivors to prepare for the future, instilling the belief that they are not victims but victors over cancer.